we're going to go, got it. We're just going to go over the principles of what our design is, the purpose of our session. I'm going to do an end-to-end workflow review and showing you a demo of what's currently built in Cerner and how your clinic will be using it. We'll have time for additional questions and as well as some next steps. Just a brief introduction of our team over here on the CST side. So there's me, Flo. I'm going to be your main key speaker today. We also have a bunch of other people that work behind the scenes every day, meeting together just to make sure everything is going to get up and running for you guys. So I'll put all the names here again. Once everyone speaks, hopefully they can introduce themselves so you'll know who they are. And I'm going to dive right into our design principles. So pretty much the whole purpose of this is so that we can all design a system that works for everyone. The main 4 pillars for that are for patient safety. We want to make sure that we're doing the best way every day possible so that we're improving quality of care, consistency of care across the board. There's this whole FaceTime, no chase time. We don't want to go chase around for charts and looking for information where everything is just a click away in the same system and everyone has access to the same information, as well as draw on data down the road. As you guys all know, I love data, and by using a system across the board, we'll have a better opportunity to draw on data for, clinical decisions, operational decisions, things like that. The more data we have, the more robust information we can get. Some of the guiding principles and focus of our enterprise design session today is to ensure that we're designing for all the healthcare organizations and that all the sites are aligned. So that's kind of how our 3 healthcare systems are kind of joining in this big CST project. And we're going to look at workflows, order sets, clinical guidelines, how we integrate our plans of care on this one common electronic health record. So what are the must-haves that we need in order to ensure that our system is working to our liking? So anything that is safety related, regulatory, financial impacts, and any content that is missing that currently does not exist, we will address those as well. So really the purpose of the session is to review what is validated and currently being used in the system and built for the kidney clinic, but also ensure that the current existing functionalities and build meets the requirements and for standard practices and purposes. And if there are any gaps, that's where we'll address them today. I went really fast with the intro. Any questions so far? No? Okay, so just gonna move on to the next slide, which is our glossary. So here's a glossary of a lot of terms you're gonna hear me say over the next couple hours. And these are all the specific terms of some of the applications within the Cerner system and what we call certain items that you're used to hearing in a different way, such as power plans. Those are like your order sets. So all your pre-printed orders, we will call them power plans in Cerner. You'll also hear us say things like power forms. Those are electronic forms. We'll have dynamic documentation, which you'll hear quite often, and that's when you would chart your clinical notes or progress notes. And ambulatory organizer is another application you'll hear a lot, and that's your summary of all your scheduled appointments in one place. We also have something called a tracking shell, which will kind of mimic your whiteboard system that you guys currently have. And then all the other applications that will be used widely across the clinic. We have power chart, scheduling appointment book, access management office, which is also short for PM office, and then work queue monitor. That's like your electronic fax. I thought I'd also just show you what some of those icons look like, because you'll see me clicking around today as well. But when you're in the Cerner system, these are going to be the icons you're going to see regularly. This is your power chart. So this is your patient's chart. Scheduling appointment book, we also call it SHAP book, is your scheduling system here, and that's what the icon looks like. Your registration system is this one right here called PM office. And your work queue monitor, electronic fax, is this purple one over here. So the icons kind of make sense once you get a hang of it. And you can kind of differentiate what they are based on the color and the little image on the icon itself. But I just thought I'd show you what they look like. Sneak preview. So I'm just going to dive right in. So for the first hour, we do have the providers on. So I'm going to jump into the provider section. And then afterwards, we'll jump back to the general clinic and nursing and scheduling allied portions of today's demo as well. If everyone's okay with that, I'm going to just dive right into the provider section of my demo. So provider assessment and documentation. When we're using Cerner, these are going to be the end-to-end workflow and the steps that the provider will use. When we say provider, we mean the physician or the nephrologist. So the enterprise workflow is that the patient will arrive to the clinic, our provider will see the patient, provider will access the patient's chart through Cerner, look at all the information like medications, medical history, allergies, things like that. See all the pertinent information you need to decide on the patient's clinical treatment, as well as enter any orders that the patient will need, such as chronic blood work, any labs for pre-transplant assessment, or any assessment diagnostic tests, things like that. It'll also be a place where the provider will be documenting their progress notes or clinic notes, as well as using FESR, which is the speech language or the speech system where you dictate into a microphone and they'll pretty much type out your notes for you. And any consultation notes, letters, things like that, I'll be showing you which notes will distribute accordingly and which ones you can document that don't need to distribute to other clinicians. On top of that, we're going to talk about ordering some of the power plans and the different type of orders you can place. And before I dive into the demo, I just wanted to show a list of the current KCC lab power plans that we do have that are built and validated. And so Nadia, I don't know if you remember, but these were the ones we validated maybe I think last summer. And these are the kidney clinic blood work power plans that were built for the regular kidney clinic standing blood work. We also have the stone standing blood work, and then also the polycystic kidney disease power plans. Any questions so far for the power plans? Do these look familiar to you?
Yes.
Yeah, okay. So the other type of orders we have are other power plans that you may place, which I'll go into more detail as well. So there's your pre-transplant baseline referral testing. There's some infusion power plans that you might want to order, as well as any renal biopsies and things like that. So just wanted to give you a quick glance over the names of those power plans and what those are right before I dive into the demo.
Well, can I ask one thing?
Yep.
We do also have the glomerulonephritis subset of patients in our clinic. Are you doing that as a separate thing? Because they do have their own requisition for the glomerulonephritis patients.
I see. So I don't think we have.
It's Wayne here. We never built it out because Sean doesn't use Cerner. He does his in a Curo still. So if we're going to move that to Cerner, then we'll need to build it out.
I see. Okay. I mean, maybe that Sean's intention was to leave it as it is then.
I think the idea would to have it all in Cerner, but
I think
that's
at
a
the
broader
time
discussion.
Yeah, I think at the time it wasn't built out because Dr. Barber wasn't live on Cerner yet, so he was still using Accuro for those. But I think that would be a gap for this session to discuss, because eventually you would want Dr. Barber to be able to order all of those labs through Cerner.
Yeah, I think that the truth is that some of us also use the requisition isn't just handy for his GN patients, but it's also handy for ours.
Okay, I'm just going to put a note. Okay, so for now, we don't have a power plan for GN labs, but we're going to add that on our list as a gap. Okay, diving into the demo. So I'm logged in as a provider right now. And so typically when you're logged in as a provider, this is what your screen would look like. It'll bring you to a landing page of your message center. And what message center is, it's essentially like your Outlook, but in Cerner. And so through the message center, you can have your personalized inbox that anyone sends a message to you can see. And all you have to do is double click on the message for it to open and read the information. We also have pools that are going to be built out, and we'll discuss this in more detail. But the type of pool Kidney Clinic has is called the nephrology, or like a nephrology kidney clinic provider pool. We can also have admin pools. So what the pool is several providers can be part of this pool. So if anyone needed to send information to the providers, but there wasn't a particular provider to send to, they would send to the pool, and any of the providers in this pool can then view that message. At the same time, if you ever wanted to send a message to a pool, we have pools set up for you to send to as well, or you can send to individual people within Cerner as well. Okay, so this is your message center. I'm not going to go into too much detail for that right now, but I'm going to jump into how to look at a patient's chart. So for a provider, what you would typically do is, for all your patients that you're going to see today, you might want to go into Ambulatory Organizer. And this is what I mentioned earlier. It's a summary view of all your patients that are booked for your clinic today, all the times and the names of who those patients are. And from there, you can select the patient. So today I have today's date on my calendar open. I've also selected the Renal Kidney Care group as my resource, and this is how it will open up my list of patients that are booked for today. And so, for example, say I want to access left kidney's chart right now. I just need to click on the patient's name. It's going to open up an assigned relationship window for me. And this is where I'm basically going to enter myself as the consulting provider or a covering provider or whatnot. This is the equivalent of you assigning on the signature sheet in a chart that you're accessing the patient's chart. So once you've selected the patient that you want to look at, it's going to bring you into the power chart view. And for providers, what we have built are several provider view end pages. So in your menu, I'm just going to keep this here. On your left side, we have the menu, which is your table of contents of all the different sections within Cerner Power Chart that you can open. So there is a provider view section with all these different M pages. We call them M pages, or different tabs that are built specific to your position. So for a kidney clinic provider, the main ones you could use would be your outpatient quick orders. You can also select additional tabs that you might not have defaulted, but there's something called outpatient chart that you can choose and add it to your tab view as well. And once you've customized which tabs you want to look at, you can also drag them around so that they're in the order that you want to see them. And once you've saved it, the next time you log in, you should have access to that information. So for a kidney clinic provider, you would likely go into your outpatient chart and view all the different sections of information that you would typically look for. Patient information, for example, if there are any documents that are documented on this patient, you can view from here. So if you go into your document section, if there was a narrative note or like a referral package, things like that, you can just click on that document and it'll open up the screen on the side for you to read. You can also look at anything that is an active issue that was entered, the patient's histories, current medications, home medications, allergies, so on and so forth. So you would review all this information and decide, okay, I need to place some orders now for this patient in the kidney clinic. And where would you go to place your orders? Our recommendation is to go to your outpatient quick orders tab. And in here, we actually have different widgets built out on how you can order certain power plans or medications and labs. So the section I want to focus on is this purple section right here. And the purple section is the power plan section. And as you can see, we have a bunch of different folders within the power plan widget that is built specifically for renal power plans. One of the examples you would use is the chronic kidney disease folder. And in there, this is where you're gonna find the common power plans that you would typically order for a kidney clinic patient. We have all the infusion power plans. We have the ESA for non-dialysis chronic patients power plan, some iron infusions. We also have day of treatment power plans for rituximab infusions, things like that. There's also a dialysis catheter insertion power plan that you may want to place. Renal biopsy is also in here. So you would select the power plan that you would want. So for example, I'm going to choose iron infusion for renal, Q weekly for up to 3 weeks. And say I also want to select a chronic lab blood work power plan. This is the one where those 5 power plans I showed previously on the PowerPoint slides, they're all living in this folder down here called the outpatient lab work. And say I want to select the one for kidney care clinic standing lab work. I would choose that one as well. And as you notice, as I click on the power plans, they turn green and my little power plan shopping cart will update with the number of power plans I've selected. Please let me know if I'm going too fast.
Maybe just one question about the iron. Now, this might be a bit too detailed, but will all of the irons different irons that we use ultimately be in here?
So right now, you mean in this power plan or to be able to be ordered?
I guess to be a power, like it's easier to have it as a power plan, right?
Yeah. So
Yeah,
we can
so
take a look at.
Yeah.
So Nadia, it's Judith. So the only iron that is currently in a power plan is iron sucrose. We've requested a power plan, but we requested its own power plan for monoferric in I think July or August, and we're waiting for it.
Okay. Yeah, I agree. That would be very important.
Yeah, and we wanted to have its own power plan since we're aiming for this to be a 1 dose versus iron sucrose that is put at a power plan as a possible 3 dose medication. So just to make sure that there is no confusion, that's why we asked for it to be its own power plan, but we're waiting on it.
Got it.
Yeah, so Judith, that's a good reminder that monoferric has its own power plan to be ordered. And have you happened to heard of any status updates on that, or is just still waiting for it to be built?
Well, I heard that it was built, but then there was some issues with it. And so the last update was a couple of weeks. Monica asked for an update and we didn't get any reply on it.
I see.
Hey, Flo, it's Maritza. It's just limited due to resourcing on the CST side.
Okay,
Yeah.
so I guess down the road, once that power plant, the monoferric iron does get built, we can also add it to this list so that you can select it from the quick orders as well as its own power plant. Does that answer your question, Nadia?
Yes, thank you.
Okay. So some other plans in here that you may want to select, you can really just click through all the different folders there are. There's some procedure ones like a renal biopsy, pre-transplant. You guys would probably be selecting this one most frequently, which is the pre-transplant baseline referral testing power plan. So everything, all the tests that are required for a pre-transplant baseline referral are all embedded into this power plan. The other thing I wanted to show currently is there are these renal short stay power plans here that don't really apply to VGH at the moment, but would you guys have an equivalent area of where you would send patients to get blood work drawn or infusions or injections, that kind of thing, that is not in the kidney clinic? Similar to renal short stay area?
Sorry, Flo. So yes, so to get infusions, we send patients to the medical infusion clinic.
Okay.
And then you had another question about blood work.
Yeah, do you ever just book a patient to come in to get blood work particularly, or they would just go to outpatient lab? Or
yeah, like we wouldn't draw the labs here. They would come to our outpatient lab.
okay. All right, so some of these may not pertain to you guys then. It's more for the renal short stay area that St. Paul's has. But if there are cases where you do want to order infusions and a patient will need to go to the infusion unit, then we'll just have to build that location into those power plans. Okay, so now I've selected all the power plans that I want to order. I can click on my little shopping cart here in the top corner, and it's going to open up all the power plans I just placed. And what I can do from there is click on modify details, and it's going to bring me to my order profile page. Oh, where'd it go? Here it is. And so just so you can take a look at those different power plans I just ordered, this is the iron infusion renal Q weekly for 3 weeks. Right now, it just has iron sucrose, as Judith mentioned. So if you were to order iron infusion for a patient, you can select this power plan, and then you can also identify a schedule of when the patient will need this iron infusion. It will be linked to a scheduling order that goes to the department where the infusion will happen. And then the kidney care standing lab work power plan, this is the one that is built specifically for the chronic monthly blood work. So it was based on the different GFR levels that a patient is currently at. So depending on the GFR levels, you would select the section to order the lab specifically. So you have to read the green portion of the power plan first, make sure you're in the correct section depending on the GFR levels. And then from there, we also have some CDS notes that guide you on what specifically you'll need to order within that area as well. And the way that the power plan is built, if you select a particular test that has this link icon next to it, it'll pretty much select all the other blood tests required for that section. And it also gives you the option to select additional ones as needed. For example, I've clicked on the urea and creatinine panel test for the 45 to 59 GFR level section. And I also want to include a hemoglobin A1C, then I just need to manually select that one. If I don't need it, then I just unselect it. But the ones that are linked will always automatically select for you. There are also drop-down arrows for certain orders as well, where you can change either the frequency or I cannot bring this drop-down over. You guys can't see my other screen, but the drop-down opened on my other screen, and it basically tells you if you want it for every 6 months for 24 months or every 1 month for 24 months. So you would select the appropriate order, but every drop-down has a different selection for you, so you can choose it based on the instructions that you need to order for. But say you've placed all the orders that you need, you would just initiate now. And what happens is it will print out a blood work rec. And what we've recommended is once that blood work rec is printed, you would make a photocopy of that rec and place it in the patient's chartlet in the future, and then give the paper rec to the patient, and the patient can bring it to whichever outpatient lab they typically get their blood work done at. And the purpose of keeping the copied version in the chart is so that if the patient ever lost it or you ever needed to fax the rec back to the lab, if the lab needed it, you still have a copy of that original order that you placed. Another power plan to look at is the renal biopsy one. And this one, again, it's just an enterprise built with all the pre-selected orders that you would typically need to select for a renal biopsy. And once you've ensured that all the tests that you need are ordered, you'll also notice this icon in power plans that has a blue circle and a white X. This just means that there are orders that you need to modify, and specify what you want to order. And so you would have to right click and modify any of the orders that have this icon and put in all the information you need. Once you've completed the information, then it will allow you to order for signature and sign for the power plan. If you don't need any of these orders, you can also unselect them. But typically what we have done is pre-selected the default orders that you would normally need to order already, so you don't have to constantly go and select certain items. I'll just show you how to modify one of the orders, for example. Anything that has a yellow field that is mandatory, it will show up as yellow and you will have to fill it out. Scheduling location right now, we have renal short stay. Nadia, where would you guys normally send patients for renal biopsies?
They go to the perioperative care center.
I see. And so would you be the one ordering it and then the order will go to the perioperative center and then they'll book it and organize the rest?
The way it currently works is that our MOAs have to find availability in ultrasound and availability in the perioperative care center. So
The
I think they call both places actually.
I see. So it's
Yeah.
it's booked by the MOAs,
Yes,
not the kidney clinic clerks.
that's right.
Okay, can my team put that down as a parking lot item?
Yeah, I guess, the other thing,
Yeah.
just since I'm unmuted here, is just even thinking about the infusion orders
Mhm.
and how we use the medical infusion clinic here. And they may have some specifications that we haven't accounted for, just because, for example, we do send them certain things or whatever, like they have some certain prerequisites
Yeah.
before we can book them. So would we also liaise with medical infusion center for our infusions to make sure that everything's okay by their standards?
Well, ideally, we should have captured most of what we need in the power plan. Are you thinking there are specific orders that are missing in here that the medical?
I don't think there's
infusion-
specific orders that are missing, but I guess, for example, they will ask us to fill out a code status form in certain instances. That's probably not in this power plan. I'm just thinking, like, is some liaison with medical infusion clinic going to happen at some point for all infusions that would normally be booked there? I guess that's just something to leave as a question for now.
Yeah, I think that's more like a workflow question. So once, say we order this power plan and the infusion order goes to the infusion clinic, once their booking clerk gets the order, then they should be communicating back with you guys on what's needed, I suppose. I just don't know. We'll have to take a look at the plans and how they're built right now and how that information flows and if anything needs to flow back, but we'll put that as a parking lot item as well for us to do an analysis.
I think it would be pretty similar to short stay where they need to do like consent for bloods and caution sheets and other pieces. Like some of it can be done online automatically when you're doing your power plans and stuff.
Yeah, I mean, in the end, there may be no difference. I just would
It's a call out.
Yeah.
Okay.
Sorry, just to clarify, the MOAs that you mentioned, Nadia, is that the MOAs for you or for the perioperative space?
Our MOAs, our Pacific Nephrology Group MOAs book our biopsies.
Okay, thank you.
So
And when you're
that's
doing the
private.
biopsies, Nadia, you still have to do the BC renal form separately as well.
Okay, good to know. Thanks.
Okay. And then this is the other power plan I just ordered, for example, and this would be the pre-transplant baseline referral testing. This one currently doesn't have anything selected. And so really it's the responsibility of the ordering provider to go choose all the appropriate orders that is required for transplant baseline testing. So you would go through, click all the ones, modify the specific order sentences you want for them. For example, change it to what you need it to. Scroll through, select all of the orders as necessary. And again, we do build in these yellow CDS notes. So it's kind of a guide for you to know when or what you need to be ordering, depending on the patient age or gender, things like that. And then you would select through all the things that you need. And then again, click initiate now. And that's what is going to send your order to where it needs to go. This one also has a built-in required instruction, I guess, is you also have to complete the BC Renal Agency renal biopsy request form when you're sending this, and then you can print it and give it to the patient or the nurses as needed. But once you've ordered everything you need and you've initiated, clicked order for signature and sign, it will tell you that you've completed your order. And in my example, because I haven't completed some of the mandatory fields where I have that blue icon with the X in it, it's telling me I need to go and complete the information, which is just a reminder for you before you can sign anything. It will force you to make sure you enter all the information required when you're placing an order. Any questions so far with ordering of the power plans?
No.
Okay.
And Nadia, it doesn't replace promise for the transplant referral piece. We still have to do like the promise
Okay,
piece
yes,
for transplant.
yeah. Okay.
This
yeah,
is really just to do the pre-printed order so
rec.
you can get the recs.
Yeah, okay.
Yeah, so the referral process will still remain status quo within promise with the referral form, and you have to fill out the absolute contraindications and all that stuff and complete all the mandatory fields before the referral is considered complete. Ordering this power plan is just so that we can get all those recs and tests done and sent to the appropriate areas where those need to be completed.
And Flo and Maritza, this can go offline separately, but there is new requirements as such that they've narrowed down some of the testing. So we'll just need to measure that against the Transplant First Initiative stuff. So we're not over ordering and stuff. So
I see.
I've
So
pared a few
recently
things down. So yeah, just recently. So
okay.
It's a
That's
new
good. I need to
initiative
know.
that's just come out.
Okay,
Like they
that's
got
good
rid
to
of
know.
PSA and glucose, for example, Flo.
Okay.
So we'll need to correct that order set.
Yeah.
Okay.
Well,
I
I
need to
mean,
know.
right now we don't have any default orders on here. So if they got rid of it and we don't need it, we just don't need to select it. But say down the road, if there's anything new that they added that we don't have, then that's definitely a gap that we'll need to put in. But yeah, we'll put a note for us as well. And Wayne, do you happen to have those new requirements that you could send to us?
Sharon Guardian has a lot of it and stuff. I'll get it to you, don't worry.
Is there TB testing on here, Flo? I think that was an addition.
TB testing.
TB, either an IGRA or TB skin test.
Rebella, no.
I do.
I'm sorry, I'm trying to read the screen.
There's,
No.
No.
They never required it before.
yeah, I don't see it here.
We order it separately. It's not currently on the power plan, and I don't think SPEP is either. So those are two that aren't currently on the power plan.
Yeah, so if there are tests here that you don't see that you want added, you can actually add to phase within the power plan and add an order. So for TB screening, it's not on the power plan right now, but now if it's required, you can look for TB screening. The skin test. You can't see. Or you can look for whichever other labs that are required that currently aren't in the power plan and add it to phase within this power plan. So that's an option for now as well. But yeah, if we can get what those new requirements are, we can also do a gap analysis as well to see what's missing or what's no longer required.
I've written myself a note.
Okay, thank you. So that's ordering of power plans. So another thing to note is once you've placed any type of orders, power plans, medications, labs, that kind of thing. This is what your order profile view will look like. You can also just look at the orders separately on their own below, and any section that has that type of order within it, you can just click through and look at it that way as well. So the main types you would normally look at would be like your medication orders, any lab orders, diagnostic tests, and things like that. It just helps you group it all together based on that section instead of having to like comb through the entire power plan to look for a specific test. So that's a different way to view all your orders as well. And as a provider, you would also be placing either referral orders or follow-up orders for your kidney clinic patients. And so one of the referral orders we have that providers can place is a referral to outpatient kidney. So we have this referral to outpatient kidney care referral order, which once you place it, it will just route to the kidney clinic clerk so that they know to book a patient for a kidney clinic appointment. Another type of order you can put is the follow-up order. Follow-up clinic kidney care. This one is also when you know you've seen the patient already and the patient will need a follow-up order, you can just place a follow-up order to kidney care. Select the modality you want, the scheduling priority, say you want to see the patient back in 2 months. And this is for a kidney clinic follow-up. So here are some of the different types of appointments we have: education, group, individual, GN, ICC, kidney clinic. I think we need a stones one in here because you guys do the stone clinic. So we'll have to add a stone clinic follow-up. But for this example, I'm just going to select the KCC follow-up. But once you place that, then again, and you can type in any free text instructions that you might have. Sorry, my screen is freezing.
And Flo, while your screen's frozen, I'm just going to check with Deborah. We don't use this function, do we? As far as I'm aware, we just in team huddle afterwards when we do the team rounds, we'll say follow-up appointment in 3 months, follow-up appointment in 6 months, and the clerk just captures it that way and books them in.
That is correct.
We don't use this function. It's a little long-winded.
Okay,
for us.
maybe just one question related to this as well. Maybe you're going to get to this flow when you talk about the other providers, but in our clinic, the providers would also be selecting whether they would be seeing the patient at the next visit or not.
Mm-hmm.
So for us, I guess whether we use this or not functionally may or may not happen, but in terms of booking other providers, they don't all necessarily get booked for the subsequent appointment, but maybe that's something for a later part of the conversation.
I guess so. You mean so a patient could come for a follow-up or their first initial assessment and see everybody, including the provider, but for their follow-up, they may not need to see a provider?
Correct.
And they would only come see, say, the nurse or
yeah,
the
they might
rest of
just
the
be
team?
nurse and physician, or nurse, physician, social work, etc.
I see.
But they might see everyone, just depends.
Yeah, so I mean, by using this follow-up order, that's where you could put those instructions. For example, nurse only, no provider, something like that.
But the physician wouldn't be the one specifying it. Maybe you'll get back to this when you talk about scheduling.
Yeah.
We generally schedule the individual providers at each visit. But if you're going to talk about scheduling later, then maybe we'll just revisit.
Yeah. I think this would be something we'll cover in more detail in our scheduling session. And I do remember you guys do book to the individual clinicians instead of like a big group chunk.
That's
where
right.
It's just assumed everyone is seeing the patient. So that will get discussed in the scheduling requirements session. But for now, I mean, just for the sake of this example, there is a follow-up to the kidney clinic order that a provider or a nurse could place. And then if it is placed, it will just show up in the request queue of a clerk. So the clerk knows to just book it following the instructions. So I won't order that, but this is how you would typically place your orders. There are a lot of other things you could order. There's anemia management, there's particular medications you can choose and select. There's a lab section here that you can go and look for a particular lab you want to order, things like that. There are also consult orders, referral orders. So this really is your one-stop shop as a provider to click through all the different widgets and what's built into there to find a particular order you want to place. And if anytime there's something you just couldn't find, that's what this new order entry widget is for. You can pretty much just search for the name of an order, for example, and find it that way and order it from here as well. But this is your whole ordering catalog. Once you've completed all your ordering, you can go back to your outpatients chart and view all the information. One of the things that we do ask the provider to do is to review the medications and home meds as part of the workflow. This can also be done by the pharmacist. So functionality wise, it's the same. Provider or pharmacist can complete these steps. And so, for example, if you needed to complete a med history, you can go to the patient's home medication section of this outpatient chart end page, and you can click on the med history status here. It'll tell you it's not done because you have like a icon with the exclamation mark on it. Once you click on it, it will actually open up your document meds by history screen. And what you can do from here is pretty much just go through the patient's medication list. You can also import from PharmaNet, which I can't really show because I don't have access to PharmaNet in this system right now, but you can import PharmaNet. You can see all the prescriptions that the patient has. And from here, you can do a BPMH, which is your best possible medication history. If there are any meds that the patient tells you about that you don't see on this list, you can also click on the add button up on top and add it as well. So you would search for it. Say they told you again, they take some vitamins. You can search for the vitamins that they told you about, enter it here, include it to your list. It always pops up on the other side. So for example, you wanted to just say that the patient is taking multiple vitamins as an oral tablet, then you can select that, say okay, and be done with it, and document the medication history. You've now added it to the medication list, and now it will say that your medication history is done. One function I forgot to mention as well is you can also, after you've reviewed all the medications here, you can see different statuses of medications that are ordered. You'll see statuses called documented, meaning you're documenting it into the system. You'll see a status also called prescribed. If you're actually prescribing a medication now for a patient, you will enter it as a prescribed status, and then ordered just means they're ordered and they're in active order within the system. So those are the three different statuses you will be looking at. So the other thing you would normally do when you're reviewing the patient's medication, as well as to complete a outpatient med rec. And so it's just the status right next to the med history status. By clicking on that, it will also open your outpatient med rec window. And so when you're in the med rec window, always make sure you're doing an outpatient reconciliation. There are other types of reconciliations, but we don't use those in an outpatient space. So just always make sure you're doing an outpatient type. And when you're in that window, it allows you to identify whether or not you're continuing a medication or you're prescribing a medication or stopping a medication. And you can pretty much just click through all the ones as you normally would when you're reconciling a patient's medications. If there are any home meds, you can also click on acknowledging remaining home meds if there are any there that haven't been acknowledged yet. And once you've gone through and completed a med rec, you can then sign for it from this screen. I'm not going to click through all of them, so I'll close that. But once it's done, it will then tell you you've completed a MedRec, and there will also be a green check mark there. So all of this will be taught in your review and training. So I'm not going to go into too much detail on all the nitty-gritty steps, but just wanted to show a quick demo of how BPMH and MedRec can be done by a provider in Cerner. Any questions so far? Okay, so on that note, we are inputting the medications and doing BPMH and MedRec in Cerner, but that doesn't mean we stop doing that in Promise. So Promise medication list will still have to be updated as well. Again, there's no interfacing between the Cerner meds and the Promise meds at the moment. So whatever you're entering and updating in Cerner, it's recommended that you also update and enter back into Promise. So lastly, for provider documentation, after you've seen a patient, you've reviewed all their medications, you've ordered all the orders that you need, you can now document a clinic note for this patient. So within your outpatient chart M page, if you scroll to the very bottom, you have different note types. So the note types to use is this either a nephrology clinic note or a nephrology clinic note free text. So the nephrology clinic note just has a built-in template of some sort for you to fill out. But you can also use a free text note and use an auto text. So I'm just going to cancel this note for now and show you how a free text note works. If you choose the free text clinic note and click on that, it'll open a blank page for you. And we do have some built-in auto texts right now. Auto texts are just built-in templates that are specifically designed for renal. And so if you start by typing comma, comma, renal, you'll see a list of all the auto texts that we have. The one that I want to focus on is the renal KCC note. And so this one is a little bit more specific than the one we just saw. And so it will give you a template that is with the more commonly documented information. It will pull in information from the different sections. For example, if there were any, interventional history or lab, things like that from the different sections of Cerner, it will pull into this template. And then for everything else, you will just have to type in or dictate your note in the rest of the clinic note. And once that's done, you can just hit submit and sign, and you can select certain people to forward this note to, or you can just leave it as is. If you want to rename the title, because they just default with the clinic note name and free text, you can call it a KCC initial assessment, for example. Hit print and sign. Actually, I don't want to print. Oops. Where'd it go? So I just need to sign it. And once I refresh it, I can now pull it up in my document, in my documentation section, or you'll be able to see it in your documentation section in your provider view as well. If I refresh. And then go to documents. Oh, where did it go? I see it here, but I should also be able to see it here.
Oh, I think your filter in that document section is just highlighting nursing and allied. You just have to change your filter.
Oh, I see.
Yeah.
There you go. Thank you. So now I can also see that documentation I just did from my M page. Okay, so that's mostly it for a provider. There are a lot of other functionalities that we can go through, but a lot of that would be taught to you during your training and workflow reviews as well, such as how to review lab work and results, things like that, there is a lab section on the M page, or there's a section called results review that pulls in all your recent lab tests if they were done in the hospital. And if there are any external labs that were done in the community, we also have external lab tests now that can pull into Cerner under the lab provincial tab. So with that, I just want to click through to make sure I touched on the notes I want to talk about. I talked about the M page, the power plans. So we do have some questions for you, Nadia. Do we do case conferences at the kidney clinic?
Yes, we do.
And what are those case conference types? I was kind of just guessing here.
So basically, each nephrologist will have case conference with their team once a week, where we review patients we've seen the previous week and patients who are coming the subsequent week.
So this is kind of like when you guys do those rounds.
Yeah.
Okay. And this is purely with the team and no patients present.
That's right.
Okay. So other than that, do you guys ever have case conferences with patients present or not so much?
Depends what you mean by that. Like,
where you would call the patient to come in just to discuss their care, like outside of their follow-up and new appointments, things like that. Would you ever have a case where you would phone patients and their family to come in and just sit all together with the multidisciplinary team and talk about their care? Or that's mostly done in
I
your
would say
follow-ups?
that, you know, depending, yes. Like, for example, well, yeah, I can think of situations where, for example, nurse and social worker might be together. That would be probably the most common. I mean, they're on so they can comment as well, but so on occasion we would do that.
Okay. Nurse plus social work. Okay, and so are those typically scheduled
Yes.
in PCIS, or it's kind of just in an external calendar?
Well, I guess I'd have to ask the clerks if I think they're usually in PCIS, like when you guys book like I'm thinking of the KRT meetings, for example, Lori, those are in PCIS, right?
Yes, they are.
Okay, so you do put them in PCIS.
Yeah.
The KRT, the educational parts, booked in, but the rounds are set each week.
You kind of have like a set schedule each week and you just know time to block off?
Yes.
We build it into PCIS for the rounds, but
Okay.
if there's an education part that requires family members and the KRT part, the educational, outside the regular appointments, then we book that into PCIS.
Okay, so the care team meeting times are built into the schedule. Okay, and then I assume the providers' times are also blocked off so they know that that's the time they need to have those meetings?
Yes, so the doctors, when we have to build PCIS manually, the scheduling system. So we have to build manually. So when we build the schedule, the providers, whenever they have rounds with their team members, they're all blocked off that week.
Okay.
We only block off the KRT when it as needed.
Okay. So I'm assuming when you guys have these care team meetings, you will have the paper chart and that's where you would typically be documenting?
Well, historically, but you know, we've been doing them by Zoom recently. Yeah.
Okay.
Sorry, there's two different ones there, Flo. So the case conferences where the
Mhm.
patients are not present,
Yep.
doing those by Zoom. The appointments where the patients are present and there's more than one provider, I mean, I guess they're, they're mostly in person.
Okay. So the ones with patients are in person, but the ones with no patients is through Zoom.
Yes.
They can do
Although,
the,
post-pandemic, we probably will go back to
In person.
the old way.
Okay.
they have been doing CRTs by Zoom also.
And KRT, that's the education class, right?
Yeah. So it's currently a mix. Yeah.
Zoom or in person. Okay, and so really, if it's in Zoom, how are you guys, how do you document what's discussed? Does one person have the chart and then they pretty much just document it all, or it's done separately?
Well, okay.
I think most people document and promise actually.
Yeah.
Okay.
So like currently what we do is, we have we have some short notes that we take during the meeting, right? During those case conferences, because it's not possible to document and promise kind of live. It's not practical. And then stuff will eventually get into promise.
Okay.
Because we need the patient, like what we basically need is that patient list for that case conference for the day to be there, accessible electronically, so we can quickly go through them, because those aren't yeah.
Okay. And so who decides which patients are discussed for these case conferences?
Well, we know because they're the patients who we've seen the previous week and the patients who are coming next week. So the clerks automatically know who those patients are. Now, sometimes we will add on patients. By request, someone may want to discuss a specific patient, and those get added on by whichever provider wants to add them.
Okay. Can a clinician also request? Like a non-provider?
Yes. Like by that you're meaning like any allied healthcare.
Or a nurse?
Yeah.
Okay. And so we're not calling that a family conference, but so for rounds, no patients present, and there are patients present for the other. Okay. Oops. And then, so yes, there are there ever multiple providers in attendance, like more than one provider?
No,
Yeah.
I mean, there's never more than one nephrologist there.
And do you guys typically order labs or prescriptions during this time?
We might, yes.
Okay. And so I heard it's typically a multidisciplinary meeting, and it sounds like the clerk and the nurse is the one that would prep for these meetings. And if it was with patient present, if a patient does not show up, then I would assume it's just rescheduled.
If the patient,
for the ones that patients are present.
oh, sorry. Okay, then repeat your question. If there's rescheduling?
Yeah, you would reschedule the patient if the
Yes.
patient didn't attend.
Yeah.
And do you guys normally order any MI medical imaging during these meetings? I put possibly.
I mean, possibly. I mean, that's often something the provider would take away and do separately, but if it's all in one place, then yes.
Yeah, okay.
Yeah.
And can anyone outside of your clinic request a case conference? Like say someone not from the kidney clinic. Would you ever have any requests? Like, hey, can you guys also discuss this patient or something like that?
We might, like, sometimes maybe vascular access clinic might ask us about someone, or so, maybe. Yeah.
Okay, so those were my main questions for you, Nadia.
Okay.
I am going to jump into some clinical trial questions because we did hear that Kitty Clinic does participate in clinical trials. Is that true?
That's right.
Would you be able to stick around for a bit longer, or is this something that Hillary can help answer as the pharmacist?
I think you might need me, actually.
Oh, okay.
Yeah, I got a few
I'll
more
try
minutes.
to-
I got about another 10 minutes or so. Is that okay?
Yeah, that should be
Okay.
good then. I'll just jump right into that then. So
Okay.
we heard that, yes, Kidney Clinic does participate in clinical trials. And so are there any standard appointments for providers doing the research? Is it done by a
No
nephrologist?
standard appointment times.
And do you have different documentation templates for research or clinical trial patients?
Yes, and usually they are specified by the specific clinical trial. Like, it's a totally separate, documentation process.
Okay. Do you have examples of those you can send us?
Sure, yeah, we can do that.
Okay.
Okay. Okay.
Okay, and are there any meds, labs, or diagnostics that are commonly ordered during these clinical trials?
Yes. Again, specified by the trial. Like, we don't send patients to VGH or Life Labs. They're usually labs that are sent away.
Okay. And are those ordered by nephrologists?
Those would be ordered by, like usually they'll often be tagged, for example, to clinical trial staff.
Okay. And how about prescriptions? Are those commonly ordered as well?
Yeah, but again, with
Depends.
trial medications, it's, totally separate process. We aren't generating prescriptions for them. Like, we aren't writing prescriptions.
Oh, I see. So how are they getting the prescriptions?
Like, if it's trial medication, for example, then the trial will provide the medication
Okay.
that the trial coordinators then will get to the patient.
Okay.
Flo, can I just ask a question? It's
Yeah.
Jeanette.
Yeah.
Hi, Nadia. It's
Hi,
Jeanette.
Jeanette.
Hi. So, for your clinical trial patients, are they being seen by your staff in there, or somebody else comes in?
Somebody else comes in.
Okay.
It's almost like they're just using the space.
Okay. So, so none of these things that being done to the clinical trial patients are staff of the KCC.
Yeah, I think that's probably true. Like, historically, that is true.
Okay. Are there any medications, clinical trial medications that being administered in there, like IV or only PO, and these are being given by the research coordinators? Is that what is going on?
Yes, I would say currently everything is separate from the way KCC runs. Yes.
Okay.
And we don't give infusions here.
Do you know who is the research coordinator that mainly goes there? Are they
the person
housed in there?
The person to talk with is probably Katie Vella. Do you know her? Have you guys touched base with her?
Not yet. She's in St. Paul's, right?
Yeah, that's right. So basically, she does the oversight for both sites, essentially.
It's probably the same process as us where we administer the medications in infusions and stuff like that. In our short stay, you'd probably do them in medical shorts unit or whatever, your infusion unit. And then
I think what the infusion meds, I think Dr. Barber, who'd be the one with the infusion meds, I think he usually books those patients in the St. Paul's short stay.
Oh,
I don't
it's
know how
Yeah.
much he's using them. I'm not sure if there are study meds that are getting infused in our medical daycare. I'm not sure, actually.
I don't know if they are going to your medical daycare, but I know that they are coming to our short stay.
Yeah, I'm pretty
Yeah.
sure he books them all there.
So
okay.
in KCC itself, when you're doing appointments, do you ever have a double booking where you have an appointment where you're attending and a research person is attending as well?
Maybe, like if, for example, they're trying to recruit a patient or they're trying to save a patient 2 visits,
Mhm.
then on occasion, they may try to do things at the same time, like on the same day.
Yeah, try to piggyback.
Yeah, yeah.
Okay, thank you.
All right, thank you.
Okay, so Jeanette, do you know who Katie is? Are you able to follow up with her?
I have her email address in my list, so we can definitely follow up.
Okay, and then we can probably just confirm with Dr. Barber too that for the infusion meds that he does book them at St. Paul's versus the VGH medical infusion unit.
Okay,
Then the workflow will just follow the same process as what renal short stay is currently doing, I suppose. And then, okay, so it does sound like it's a completely separate team of clinical trial individuals that come into the kidney clinic space and uses the space to carry out their trials.
Yeah.
Okay, and so are there any research procedures done in the clinic? We were kind of talking about like med admin and things like that, and I heard there isn't.
No.
And do researchers or research team members that are not staff come to the clinic to do procedures? So no. And what documentation is required? Do you know if they have any documentation where you guys can also see, or?
So normally there'll be, if someone, for example, comes from for a clinical trial visit, there'll be a specific documentation form that has to be filled out for the clinical trial that we fill out and we give to the the trial coordinator. And that's part of clinical trial documentation. So it's totally separate from what we would do from our clinical documentation.
Okay. And who fills that out?
So if, for example, so maybe a combination of a trial coordinator and the provider.
Okay. And does your clinic have any medication used for research or clinical trials on site? I don't think you guys stock any of the meds on site.
No.
So MedAdmin, again, I'm hearing it's not administered at the clinic.
Right.
Are research medications ordered and placed in this clinic though? Probably the ones that Dr. Barber orders.
Yes.
Like he might order it from kidney clinic, but it's going elsewhere to be administered. So
well, I mean, I guess I'm not 100% sure what you're asking in a sense. Like we currently we don't, like if I visualize this correctly in a way, what you're asking, is this a prescription you would be doing through the clinic or is this a totally separate prescription process? Is that kind of what's behind the question? Like, just so that I get what because he probably does fill out a prescription for a certain med or make an adjustment, for example, that, is totally separate. It is at the end of the day, a totally separate process. It may be good to ask him so that,
I think it's more, I think it's more about if there's a research medication being given, is the medication actually being ordered in the clinic? And then the follow-up to that would be, how is that medication actually being obtained or distributed? Is it the fact that there's a supply that's provided to the unit and it's sort of considered ward stock, or is it gets sent down to the pharmacy and then pharmacy does their magic with dispensing? So I think the better question we need to do is to talk to Kate.
I think so. Yeah.
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 Agree.
Okay, then do you think it's okay if we skip the rest of the trial questions then and maybe have a session with Kate instead to get down to the nitty-gritty?
I think so.
Yeah, that might be better.
That makes sense.
Yeah.
Okay, then we won't take up too much of Dr. Zelenardo's time either. But yeah, that's it for the
Okay,
provider
thanks
part.
everyone.
Okay, thanks. Bye. Okay, so we'll park the clinical trial questions to have a discussion with Kate and Jeanette. We can arrange that to follow up.
Yeah, for sure.
Okay, so I'm gonna jump back now to the rest of the slides. First of all, does anyone have any questions for me before I move on? Nope. Okay, so I'm just gonna dive into the rest of the flow of the clinic then. So for the kidney clinic, I have the name VGH Kidney Care Clinic. Is that correct? Or do you guys just call it Kidney Clinic?
I think the official name is Kidney Care Clinic.
Okay, so we'll leave that. And so it is an outpatient ambulatory clinic with multidisciplinary staff at the Gordon Diamond Center, Station 4, 5th floor. We have patient population is 17 plus. Are there any situations that you might see patients under 17?
No.
And the encounter types that I heard so far that we have are outpatient encounter types, either individual appointments, there's group appointments. You guys have phone calls and virtual health like Zoom appointments as well. Are there any other type of appointments that is missing from this list?
I don't think so. I think that covers it.
Perfect.
We actually use Teladoc for virtual health as well.
Sorry, what was that?
We also use Teladoc for virtual health.
Teladoc. How do you spell that?
DOC. I think it's TELADOC.
Okay.
And I think we might do some group virtual health appointments.
Okay. And hours of operation are Monday to Friday, 9 to 5, closed weekends and stats.
That's correct.
All right. And so I have the total number of people by profession. There's the 8 providers, 5 nurses, 1 PCC, 2 clerks, 2 pharmacists, 2 dietitians, 2 social workers. Is that correct?
No, the dietitian, we have 3.
Wow.
And pharmacists, we have
sorry,
1,
Annie.
right? Yeah, pharmacists, we only got Hillary right now.
And social workers, there's 3, although 2 are full-time, 1 is not, but 3 in total.
Okay, so for pharmacists, there's just the 1, or there should be 2, but currently there's just 1.
It should be. Is it?
I don't know.
Yeah, we just don't know.
We just have 1, I think.
I'll just do 1 or 2.
23.
Okay.
23. So nurses, we have actually 6 though.
Yeah, 6 nurses.
Yeah.
Oh, okay. But the rest look good? I also just included the fellows, residents, and med students that can come and go. And then if there were any clerical practicum students, at most, you guys would take 1 per cohort, if any. Okay. I also included other staff that may occasionally work in this clinic is the triage nurse position. There's the palliative care nurse position. Is that what Ina's position is called?
Yes. Yeah,
Okay.
we call her a symptom management nurse.
Oh, okay.
She's included in the nurses, isn't
Yeah.
she? For KCC nurses?
Yeah, she's
Oh, so she's
included.
included in the 6.
Yeah, so she's included in the 6.
Okay. I see. So are there patients that are just booked to her then?
Yeah, she had her designated group of patients. So
Okay. And then research coordinators, do you know how many there
Uh,
are?
I just don't know. They have a few, but like it is not constantly the same number.
Okay,
There's 3 that I know of.
I'll just put that.
Mhm.
Okay. And so in addition to PCIS Promise, Acro, Care Connect, BC HealthNet, what other systems do you guys use that is not listed here? I have a question, does social work use Paris?
Yes, we have read only, so we don't document on Paris, but we can view the notes. Yes.
Okay. Are there any other systems that I'm missing?
We have PLS, if that counts, the interpretive services.
Yeah.
For booking interpreters, pretty much.
Anything else?
Is PharmaNet included in that list?
Permanent. Oh yeah, I can include that as well. Okay. If I got all the general info collected, I'm just gonna skip to the next. So just wanted to high level talk about what the workflows are in the kidney clinic. This is just something I created like ages ago. I just wanted to make sure it's still accurate. Essentially, once there's a kidney clinic referral from the PNG office and the patient is seen at the kidney clinic, then patient will go through a series of follow-ups and discuss the different modality types that they want to go into for dialysis treatment. And the areas that kidney clinic patients are most typically referred to are pre-transplant, vascular clinic, and PD school. Is that still accurate?
The vascular access clinic, it is called dialysis access clinic now, DAC.
Oh yeah, they did mention that last
Mhm,
time too.
mhm.
So yeah, we just needed confirmation of the
Change, yeah,
official name
okay.
change.
And
then
also
so
PD school, PPD unit, they call independent dialysis unit too.
yeah,
Change
okay.
already, yeah.
Okay, so other than that, and then I think those are the main
Mhm.
modalities that they can select and go
Oh,
into.
actually, there's a modality we added. It's called conservative. It's like
Conservative care?
belongs, yeah, conservative that belongs to INA. That's patient they are not suitable for transplant, and they are not also going for dialysis.
Ah. Okay, so conservative care.
Yeah.
Okay, and so for those patients, they'll still be referred to the kidney clinic, but then they'll just be following the conservative care pathway.
Yes, that's correct.
Okay, and then within the kidney clinic, there's the regular kidney clinic, there's stone clinic and GN clinic still?
Yes, and we have a PCKD clinic,
ACC,
polycystic kidney.
Just PKD.
PKD.
PKD, yeah, PKD clinic,
Okay.
yeah.
And how about the education classes? I heard there's KRT.
There's one more referral that we introduced. It was the RD only.
RD only?
Mhm.
Education classes?
Now, yes, we don't have, because of pandemic, we don't have group education anymore. I mean, coming in person now, but
Okay,
may change. So we have KRT group and one-on-one.
and there's Zoom for now.
Zoom or both, actually. They're coming in person or yeah.
Okay. Okay, so I'm just gonna quickly talk about the referral triage workflow and the end-to-end workflow basically of how a patient gets referred into the kidney clinic and then how all that stuff gets processed and how clerks versus nurses versus allied clinicians will review and chart information. And so from what I understand, referral triage workflow, it's all the referrals are mostly coming from PNG office. And sometimes it can come from other areas like transplant or elsewhere internally. Is that correct? But the bulk would be coming from PNG?
Yes, and then we get to, you can add transplant referral to the other pile.
Sorry, which pile?
With the referrals received, you said?
Yeah.
With the CKD and the PCK or the stone, or they have the, it's also a transplant referral. That one, yeah.
Well, we should say post transplant. They are
Failing transplant.
Yeah, failing
Yeah.
transplant. Yeah.
Okay. Oh yeah, so that's this arrow going back. Okay. Okay, so I'm gonna just jump right in and show you guys how you're going to process all your external and internal referrals. So again, back to Cerner applications. This is where, Lori, you will be accessing the work queue monitor application, and this is going to be your electronic fax. And then on top of that, you will also be using scheduling appointment book. This is what's going to replace your PCIS scheduling. So first of all, I'm going to show you work QM. So the work queue monitor is your electronic fax. And so each clinic will have their own fax queue. You're just going to see a ton of names across the top of my toolbar right now, but for you guys, you'll have the areas that you have access to. And so right now I'm showing the St. Paul's Kidney Clinic one. You guys will have a VGH Kidney Clinic one, and any faxes that are coming into this electronic queue, which is your fax number, will show here. And so I've just uploaded some demo documents where you can click through and just look at them and pretend that they're different referrals or different faxes that are coming through to your queue. So say this is a PNG referral for a new kidney clinic start. You would see the referral directly in your work queue. And what you will do is go into your scheduling book, because from what I understand, there is no triaging in a sense where you would ever, accept or reject a referral. If you get a referral from PNG, I'm assuming, Lori, you process and book those pretty much right away.
Sorry, they actually changed that now because all the electives go to the nurses first to take a look at. And then
I see.
But we keep the semi-urgents and urgents. But then the nurses review the review. We put it into Promise 4 and Classic. We enter those parts. And then like the CKD status and registration. And then it goes off to the nurses to take a look at. And then it comes back to us.
So the nurses will have to take a look first before it comes back to the clerks to book?
For the elective ones.
For the elective ones. And for those elective ones, will there be a chance that the nurses will accept or reject them?
Yeah. Or they give us notes on what they want to do with them.
I see. So there could be a case where after the nurse reviews it and they said, oh, this is not appropriate, we're going to reject this referral and send it back.
Yeah, or just give us, say, this is a conservative, or it can be booked further out than the 3 months or 4 months kind of thing.
I see. Okay. Okay, so I'll just show you like a regular referral that comes in that has a priority that you need to book within like a semi-urgent time that comes through your fax first, and then we can discuss more of those details in our scheduling session. So you're going to see the fax. It's going to be in your queue. You can click on it, read the referral. Then you're going to go into the scheduling application. Once you log into the scheduling application, you are going to look up the patient and book them for the appointment. And so when you're in Chatbook, there's 2 tabs. You either have a bookshelf tab or an appointment tab. And so in your bookshelf, you can find the bookshelf that is built for you. Oops. And so we have the kidney care bookshelf. And this is what's going to look like. You'll have different type of books. So for now, what St. Paul's has is a SPH renal kidney care book, and then also an SPH renal KCC education book. If this is typically how you guys would book at VGH as well, we can mimic how it's set up, or again, in our scheduling sessions, we will have more details from you and build out the books accordingly. But I'll just show you so far what it looks like for St. Paul's. So they have the kidney clinic appointment types, the follow-up types. There's their ICC clinic. They have GN clinic, as well as telehealth appointment types. And so based on the different columns and resources, this is where you would book your patients into the different sections. And then there's also the education book that has just like an open template where you can book patients in for education sessions. For them, they have education sessions with a nurse. So for processing this referral though, I've received it and I see that the patient's name is on the referral, PHN is all there. I'm going to go and schedule the appointment. And so I'm going to look up the name of my patient from the referral. And it's this VGH renal test KCC patient. And I can see that they currently don't have a pre-recurring or a pre-outpatient appointment type with the kidney clinic. So I'm going to just go and select.
Just click OK to continue. You'll be forced to add the encounter at the end.
Oh, that's right. Okay, so I have to book the appointment first before I create the encounter. So I'm just going to select the name of the patient that I want to book the appointment for, and I'm going to hit OK. It's going to ask me for my facility. And so we have SPH Renal Kidney Care Clinics. So for you guys, it would be VGH Renal Kidney Care Clinics. And I'm going to hit OK. Once I do that, it's going to do an external MPI search within the system to find the patient. And once it does, it will populate the patient's name in my appointment tab. From the appointment tab, I now have to put in my location. And so our location is called SPH Kidney Care. And then once you choose the appropriate location, it will give you all the appropriate options you have associated to this location. So these are the different appointment types that are currently built for kidney care. So I think what we have missing would be the Stone Clinic follow-up and Stone Clinic new. Otherwise, these should be the ones that you guys will also be able to use. In this case, I'm going to select Kidney Care New for my example and say OK. And then what the reason for visit is would just be initial CKD or initial assessment, something like that. And put in your referring provider. So whoever the referral was from, so you'll go back and look, oh, it was from Nadia. Then I would go put in Nadia as the referring provider. And then the referral date. So I'm going to check when it, oh, January 21st. And then the priority. So this is where you can put in the priority based on the referral itself, or you can just choose next available appointment. In this case, I'm just going to choose next available appointment. Interpreter required, again, based on the referral form, if it was indicated yes or no. And then visit modality would be in person. And then for the rest of the information, this is if this patient was part of a research study as well, this is where you can indicate that on the booking. But otherwise, I'm just going to leave that and move the patient.
Yeah. So it's Wayne here. Before you go on any further, this is where I'm going to advocate for VGH. There is an appointment reminder function in Cerner that has not been put through to all areas and is not built out, you guys need to advocate for this to be done as well. Basically, what it will do is send an appointment reminder to the patient 3 days before their appointment. So therefore, your clerks don't have to ring up. You need to advocate for this.
Yeah, that's the automated appointment reminder function.
Yeah.
Yeah. So does St. Paul's currently use it?
We don't, because it was only built, it was only trialed on cardiac, and there's not in scope to build it out to the rest of the areas. We need to advocate for it, because then you don't have to do the clinic reminder calls or anything else. It happens automatically.
Yeah, so we'll definitely put that down on our parking lot items to discuss the automated appointment reminder functionality. But currently, Lori, you guys just phone the patients prior to their appointments to remind them, right?
We only phone the ones that are not attached to the doctors. So the ones that are attached to P&G, P&G's receptionists phone them.
Ah, okay. So the ones that are with a provider, the private office secretaries call the patient to remind them. The ones that are appointments without the provider, then the kidney clinic clerks call the patient to remind them of the appointment.
Yeah, whether it's fistula follow-ups or transplants or anything like that. So.
Okay, good to know. Okay, so
Flo,
I'm now.
Sorry, Flo, this
yeah.
is Dan. Quick question. You know, you had your appointments, the types of appointments. I know we have the Transplant First project going on. Would that be one of the ones we could add in there as far as the type of appointment? Could be a transplant education?
Yeah, I believe there was an appointment type for education in there. How do I go back to see it now?
If you delete the appointment type and then click on the ellipsis button, it will show you the whole list. But to answer the question, and this is Heather from the scheduling team, and there will be a scheduling specific requirements gathering session. And that's where you can go through all these appointment types in detail and identify any gaps, and other appointments can be added if necessary.
Thank you.
Yeah, so there is one called Kidney Care Individual Education right now. But if you wanted one that is specifically to differentiate that it's for the transplant first appointment type, then that's probably going to be discussed in Heather in the scheduling session that Heather just mentioned.
This is Deborah from St. Paul's, and we use the Kidney Care Individual Education for RRT, for transplant education, or for like ESA training as well. So we use the same appointment, and then just in the notes we put specifically what the education is for.
Yeah, that's great. I was just going to recommend that. There is a scheduling comments field that Flo can show you at the bottom, and you can enter the type of education in that field, and then that information will carry forward into the ambulatory organizer in Power Chart, so the clinicians can see that information as well.
Yeah, so if you chose that individual education appointment type, there is a scheduling comments field at the very bottom of the appointments tab where you could type in specifically like transplant first or whatever type of education appointment that would be. And then once you put that there and then you book it, I'll just leave the comment there so you can see what it looks like. But then once you book it, then you would be able to, do I have to move it again, Heather, now that I've changed?
Yes, any updates, you have to hit move so you can leave it. Yeah, exactly.
Yeah,
that's
okay. So that's a good thing to know. Anytime you've made any updates or changes to the fields, and you'll have to just move the patient back to this work in progress section again. So now that I've had all the fields that I need filled out, my patient now shows up in the WIP. And what I could do is then basically drag the patient to the appointment time that I want the patient booked. And so once I do that, it will now show up as yellow, meaning I've scheduled them into this time slot. And then the next step I need to do is to confirm the appointment. Once I click on confirm, the confirm window will open, and then I'm going to click OK. And once I click OK, it's going to ask me which encounter type do I want to link this appointment to. And because I currently don't have the encounter for this patient, I need to go add an encounter. And by clicking that, I will have this available conversation window open, and I want to select pre-register outpatient as my encounter and hit OK. So essentially what I'm doing is taking that referral, I booked the appointment, I'm now creating a pre-outpatient encounter for this patient. They'll bring me to the pre-register outpatient window. In there, most of the information, the demographic information would be filled out. The one important piece to note is that there is a promise field here, and we always want to make sure that the promise field is selected as yes. For all renal patients, every time you pre-register a renal patient, we have to select promise yes. Another crucial piece of information is this clinic flag. Anytime we're registering a patient to a renal clinic, we also have to include the clinic flag associated to this area. So for kidney clinic, we have the renal insufficiency flag. And so to do that, you basically just click on the clinic flag section, you type out the keyword that you're looking for, select the appropriate clinic flag that you want. For example, failing transplant, and then I can move it over to my selected option. But for this example, I just want renal insufficiency because this is our kidney clinic patient. So you can always move more than one flag over. And then once you have that patient information done, you want to go into your encounter information. And from there, you want to select pre-outpatient. Medical service will always be nephrology. Reason for visit already pre-populated from before. It will now default to your location, which would be your kidney care location. And then it just gives you an opportunity to fill out any other pertinent information that you might have. And if you go click complete, it will now tell you that you've pre-registered the patient. So once I've completed that and I've confirmed the appointment, you can see that the patient's name turned into this turquoise teal blue color, meaning I have confirmed my appointment. Any questions so far?
Yes. Sorry, Lori, clerical. Question, when you're booking that single appointment, we book with multiple providers. How does that work? And are you going to cover that in the scheduling?
Yeah, we're going to cover that in the scheduling. So this is where you will have the opportunity to explain to our scheduling analysts how the booking process happens. And I know you guys book it to particular providers, and then you'll have all the different disciplines as well that you might have to schedule to. So right now, what I'm showing you is just the function of booking. This may not look like what your appointment book slots maybe, so that we'll cover in the scheduling session.
Okay, thank you.
Yep. So for this one, I've booked a new kidney clinic follow-up appointment for my test patient. And the last step I have now is, remember we have that referral form that came faxed into our queue. I'm now going to index this referral to the encounter that I just created. So to do that, I'm going to go back into my work QM. I'm going to double click on that referral. Once I double click it, it's going to open up my add modify work item window. From there, I'm going to select patient, and I'm just going to look for the patient I just registered, and that's this one here, test KCC. And here's the encounter that I just created, that pre-outpatient kidney clinic encounter. And I'm going to say okay. Once I selected my patient, you'll now see on the top blue bar that the patient information has populated. And I'm going to now index this referral package to the patient's chart. So So to do that, I'm going to go to document type. I'm going to put in referral package. And then once I put in referral package, I'm going to choose status as complete because I've booked the patient already and registered their encounter. And the last step is to fill in the performing provider piece. This part is a little funny because I'm actually going to put scanned document as the name of the performing provider. And this is just how the enterprise workflow is for indexing scanned documents. And once I hit OK, you'll now see that that referral that I just worked on has disappeared from my list. And this is how you keep track of all the faxes coming in through your queue. And once you've indexed it, when you're in Chatbook, there is a little icon here to link you to PowerChart, and that's where you can click on that to open up PowerChart to make sure that the referral package is now uploaded to the patient's chart. So if you refresh it, you should now see that the referral package that I indexed from January 21st is now in the documentation section. And then this is where the providers and the nurses can now go into the patient's power chart and review the referral package and look at all the other patient information. Okay. Any questions so far? So that's how you would process a referral that's coming through to you through a fax. The other way that this can be done is if a provider, let me find my provider. If a provider actually enters a referral order. And so internally, providers can place a referral order to the kidney clinic. And so I'm just logged in as a provider right now. I'm gonna refer left kidney to the kidney clinic. And I'm going to select my referral to outpatient kidney clinic order. I'm going to choose my priority. I need this appointment within the next 3 months, for example. And I'm going to select the appropriate location. So again, for the drop-down locations, we're missing Stone Clinic. So we will add a Stone Clinic here as well. But for this purpose, I'm going to choose kidney care. And then referral reason, I could put in initial CKD, initial assessment, for example, and hit sign. So I've now, as a provider, sent a referral order to the kidney clinic. And what that means is for you, Lori, when you're in your scheduling appointment book, you can actually go to one of these icons, which is your request list. And what that opens up is your request list by your location. And our list is called the Ambulatory Renal Future Request. You would choose your location. And once you hit find, it's going to refresh for you and give you all the requests that were sent internally to your request list. And there you will see the request that I had just placed for left kidney. And from here, this is where you will complete the order. And basically go through the steps of booking the patient like I had just shown. So those are the 2 ways that you would process a referral. Any questions, Lori?
It seems a bit backwards on the, I'll think about this one.
Yeah, it is very different from what you're used to in PCIS and the way it's done. But yeah, this is how Cerner is built. It does look quite different from what you're used to, but this we'll go over in more detail with you in the scheduling sessions and as well when you get training and boot camps and things like that.
What about there's 2 clerks involved. So do the 2 clerks have access to viewing that, the fax request list coming in?
Yeah, so whoever whoever the clerks are, your roles will be the same, and you will both have the same access to the fax queue as well as this request list. So it's just a matter of, knowing to constantly check and review the request list. I would say these two are your main sources of requests. It would be the fax queue to see those external referrals coming from PNG, and anything on this scheduling request list that are coming from your internal referrals to the kidney clinic.
But this is going to take away the paper charting, correct?
Correct. Yeah. And so ideally you would have two monitors up while you're working. You'll have your main monitor, and then you might have another monitor, and that's where you can keep your fax queue or your request list and constantly just refresh and load. However that works for you, that replaces all the paper that you're getting and having to like create a file and a chart and things like that. You'll just be checking these queues. Okay. How are we on time? Does anyone need a break, quick 5-minute break before I keep going, or are we still good to go? No? Okay. I'm assuming that means we're still good to go. So just want to clarify, this is still the fax number, and there's only one fax number for the kidney clinic. So anything that comes through this fax number will be showing up in that fax queue that I was talking about. And so you would be getting internal referrals from VGH, external referrals will be coming from PNG. Again, we'll discuss the details of scheduling in our scheduling section.
Sorry, what's the ones internal from VGH about?
Oh, just like if it was coming from post-transplant, like failing transplant, or if anyone that has access to Cerner, they can send you that referral order. The referral order that I just put, that goes to your request list.
Okay, because
So that would be an internal referral.
Yeah, because no, we all the referrals go through PNG first, except the failing grafts. So.
Oh, okay. So think of it as if it was a failing graft and they had access to Cerner, they would probably put in this referral order that will go to your queue, and then everything else then would be your external through the fax. Okay. And yeah, there is no wait list. I just wanted to confirm you guys don't really have a wait list other than the process that you guys have with the elective referrals versus the urgent and semi-urgent. Okay. Scheduling, I think we went over confirm appointment. Okay, so we're now at the check-in process. So what happens on the day of that the patient arrives for their appointment? So what we do is we have a check-in process within Cerner. And to do that, the clerks will actually be using a location list. You can either use the location list to check in, or you can go directly into your appointment book and check in patients manually. Oops. Let me just close this. Or you can check in patients manually from your book on that day. So if you wanted to do it manually from here, you can just go right click on the name of the patient who shows up for your 1 o'clock appointment, and you can go into actions, check in the patient. When you click on that, you get a check-in window, and you just want to ensure that the date and time are correct. You want to check them into the correct tracking location, which will be built out for your area. So right now I'm just going to use the 6A waiting room. You guys will probably have a VGH kidney clinic waiting room, for example, and hit OK. When you check the patient in, you now have to select register outpatient as your conversation, because you're going to now change that pre-outpatient encounter to an outpatient encounter. And so while it does that, it opens up your register outpatient screen, and you'll get back to your patient information page. This is where you'll be able to see whether or not your patient has the promise flag as well as the clinic flag. You'll also go into your encounter information, and this is where you're going to now switch it to an outpatient appointment type. As you're checking in the patient, you're also going to be checking their ID. And so you would put in their source of ID. Typically is their care card with photo. You will ask them, is Dr. Alex Test still your primary care provider? And they'll tell you yes. So there are a bunch of fields that you will have to go through during the check-in process to ensure that all the fields are filled out. And then in the insurance tab, there's mandatory field as well. Is this an accident related visit? You would say no, so on and so forth. So you would click through the tabs, fill out all the mandatory fields and hit complete. If there were any sections that were not complete, the system will tell you. It won't let you move forward until you've completed all the fields. And then lastly, you will get a document selection window that opens up. This is for you to print any armbands, face sheets, or lab labels, but most cases you won't need this, so it's defaulted to not print. And then you would just say okay. So once you've checked in the patient, you can now see that it has turned green. Another way to check in patients is if you went to your inquiry list, and that is by going to your patient inquiry, select your location tab, choose location by person name, ambulatory clinic type, your location name, and then hit find. Once you do that, it will open all the patients that are coming in for today's time frame that you've set. And you can also check in from here. So say I want to check in right kidney, I would then right-click right kidney and go, where's my actions? Oh, there. Check in, sorry. So you would right click on the name of the patient and select check in, and then the process is the same as I just showed. So you would check in the patient, same idea. You would go through, check them into the right location, finish all the registration tabs and hit OK. So once you've checked in the patient, what the providers and nurses can see though, is that when they go into the ambulatory organizer, they'll see a checked in status, meaning the patient has arrived and they're probably just sitting in the waiting room, and it'll tell you that they're in the waiting room. And this is when the clinicians and providers can see that the patients are there, and then they can go and grab the patient, or the patient can go in and see the provider or the clinician. As the patients are checked in throughout the day, you'll just constantly see the status go from confirmed to checked in.
Hey Flo, I was just wondering if you can refresh your screen. I wonder if that scheduling comment will show up now.
Ah, there.
There we go.
Thank you. So earlier when I put in that scheduling comment for the example of if we were booking an individual education class, whenever you type in the scheduling comment, it will show up on your ambulatory organizer, and that's how your providers and clinicians will know that this is a patient coming for that type of class. Any questions with the clerical check-in process? Okay, so once you've checked them into the ambulatory organizer, I want to bring your attention now to the tracking shell. So what the tracking shell is kind of the equivalent of what your whiteboard is going to be. You know how you guys have a whiteboard and you'll have the different columns of the different providers and clinicians there. And as you see your patients, you check off that you've seen them on the whiteboard. So this tracking shell is going to replace that function. And so as you check in patients, the purpose of checking them in is so that they'll show up on your tracking shell. And from the tracking shell, each clinician can then find the patient that's on the tracking shell for the day and identify that they've either they're in progress seeing the patient, or they've started seeing the patient, or they've already completed seeing the patient, or they are not seeing the patient. You can select canceled or not reviewed. So there are different statuses here for each clinician, as you can see the different columns built out to update based on whether they've seen the patient or not. And then ideally you want to have complete across the board. meaning everyone has now seen the patient. And so when you look at tracking shell, you know that the patient has gone and seen everyone they need to, and their visit is complete. So tracking shell is just one of the tools that is built to mimic your whiteboard, and there are different functionalities and filters that are built into a tracking shell that help you filter down your patients for the day, what type of patients, who's seen them, who still hasn't seen them, that kind of thing. There's a whole bunch of different icons for you to learn to understand what those mean. Again, we'll go into more detail for those icons in our training sessions, but essentially, this is how you're going to keep track of where your patient's at during that clinic visit. Does that make sense? Any questions? So each clinician or provider will be using their own column and updating the status next to the name as they see patients. Okay. So that was the check-in, check-out process and the checking the registration as patients come. The only question I have is currently with COVID, are there any COVID screening questionnaires that are done prior to the patient arriving or at the time the patient shows up? Do you guys do a screening there? And are there any other intake forms or paperwork that patients need to complete before they're seen?
I don't know who wants to answer this, but there's a COVID screening form that we have to, that the provider has to fill out with the patient and take their temperatures.
So is this done by the physician or a nurse?
If it's initial patient, then the clerk will do it. But if it's a follow-up visit or a KRT or education, that the patient's already been seen by the clinic, then it's the first provider on that list will do it.
I see. Okay, so whoever sees that person first will be the one. Okay. Okay. If it's initial. Okay, and so for the initial visit, Lori, do you also take the temperature then and write it down somewhere?
Yes, on the COVID screening form.
On the COVID screening form, and I'm assuming this is the form from Promise?
I don't.
Or you have your own?
I can ask that where it came from.
Yes, it is the one from Promise.
The Promise one? Okay. So you print them out and have them ready for when the patient arrives, fill it out, take their temperature, put in the chart.
Not put it in the chart, we just have a separate folder.
Oh, separate folder. Okay.
And then Dan comes to collect them.
Sorry, who collects them?
Dan?
Okay. So how about initial questionnaires? Do patients still have those initial questionnaires they need to fill out if they're coming for their first visit?
So if it's initial patient, we go through the O phase, and then we have the consent for the picture.
Mm-hmm.
And then there's also I don't have the form in front of me, but it's the 2-page one, maybe the social worker or nurse knows the name of it, the initial assessment form that the patient fills out.
It's probably this one. So they have to fill that out when they arrive and sign the consent for photo.
Well, we go through the demographics on the O phase. So we'll ask them to just present their ID and then go through all their their family doctor, their next of kin, all that information on the O phase. And then we ask them, what's it called? Then we get the consent for the picture. We take their picture, get them to sign that one. And then the initial assessment, we get them to fill that out when they're waiting for the provider.
Okay.
And then we'll take their height and weight.
And take height and weight.
That's usually consent for photo, height, and weight, and then initial assessment.
Okay, got it.
But
And then, sorry?
the follow-up patients that come in, we have to get them to fill, we check their demographics, and on the back side, there's the fill out of the scheduling form. I think you remember those. There's an ESAS form on the back side. Yeah.
All right. Follow-up visits. So the schedule form?
Scheduling, yeah, whatever they're called, the scheduling form. On the back side is the ESAS where the patient fills out.
Okay. Is there anything else we're missing? That patients will have to fill out? No? I think we're good. Okay. All right. And so that's it. So we're gonna jump into the demo for the nurses and allied health next. Just want to check again. We're doing pretty good on time. Does anyone need a 5-minute break before I go into the nursing and allied health sections? Or does everyone want me to just power through?
Just go for it, Fro.
Okay. All right. So for nursing, basically what our enterprise workflow is, once the patient has arrived, you're going to, again, see who the patients are that are booked in the ambulatory organizer. From there, you're going to go into various sections of their power chart to review information, histories, documentation, and such. And then for nursing, once you're seeing the patient, there are various areas where you will be documenting all your nursing information. So I'm going to dive right in as a nurse. If I can choose the right one. I have so many tabs open, you guys. Okay, it's the first one. Okay, so I am now logged in as a nurse, and usually my landing page would show me my ambulatory organizer. Again, this is where all the appointments that are scheduled for today will show up. And I'm going to then click on the patient that I want to open the chart for, and I'm going to assign my relationship to this patient as their nurse. So once I've done that, I will then see the power chart view. On the top in the gray area, this is your toolbar where you will navigate to all the different applications within Cerner and power chart to get to the sections you need to. You also have your main table of contents, menu item of all the different power chart sections as well. It looks pretty similar to the provider view, but the big difference for nurses is there's an ambulatory workflow view instead. And from there, you will have also different M pages to look at. So for ambulatory nurse, you will be using the ambulatory workflow tab. And then I believe there are other tabs available if you need to find them. Again, always click through to see if there's any other tabs in here that make sense to you. Maybe you want to have a demographics tab as well. This gives you all the patient's pertinent information in a page, and then again, drag and move the tabs around as you see fit, whatever works best for you. But the main one we're going to focus on is the ambulatory workflow. So in here, this is where, same idea, you can click through all the different components within this M page to view all the pertinent information on this patient. So if there are any documentations, you can see it from here. I can see the referral package from here. Because it's a scanned document, I actually have to click on the view document function so that it opens up. Oh, it's so big. So that it opens up on a different window. After I've reviewed that, I can take a look at the patient's home medications, any measurements, vitals, that kind of thing that pulled in from elsewhere. If there's any histories, lab results, so on and so forth, you can essentially click through all of these different components to see all the patient's information. So for kidney clinic nurses, when you are assessing a patient, The main form of documentation we're going to use is called the ad hoc power forms. And so to find that, we have to go into this ad hoc application. So by clicking on ad hoc up here on our toolbar, you're going to find a bunch of different folders. Look for the one that says Adult Ambulatory Specialty Clinic. We have a nifty renal folder, and within our renal folder, we have forms called Ambulatory Adult Renal Quick Assessment, as well as Ambulatory Assessment Renal. These are the two main forms that you will focus on. So for your initial assessment patients, these are all your new kidney clinic patients. The form we use is the Ambulatory Assessment Renal Power Form. So you would select the form and hit chart. Once you're in there, you're going to see a bunch of different sections on the side, and the ones that are mandatory are the ones with the red asterisks. But what you want to do is, as you are seeing your patient, you want to click through all the different sections and document all the information as required. So measurements, you've got your dose weight, your vital signs, that type of information. There's also the infectious disease risk screening, advanced care plan, violence and aggression. These are your mandatory fields, histories, so on and so forth. As you click through each section, again, we'll go through more of this in your training so you can actually try and play with the functionalities. This is where you would document. So, you're now meeting with a patient and what is their modality of choice, and say they chose hemodialysis. Have they had orientation? Yes, they did. Did you also initiate their transplant? No. And you would just go through and click all the fields that are built into this form. There are also text boxes in each section, or most of the sections have additional comments, text boxes where you can free text type stuff. So anything else you want to add that is not in a selectable field, you can put in your notes there. When you're done, you just need to click on the sign form checkbox. Right now, the system is not allowing me to sign because I haven't completed any of the mandatory fields, but pretend that I did and I click the signed checkbox, it will then save my charting. So actually, I'll just do that so you know what it looks like. I'm just gonna put in all the mandatory stuff. I don't know, I'm literally just clicking whatever. Advanced care plan, yes. Violence and aggression, no risk. Okay, so say I've charted everything, I've completed all the mandatory fields, and now I can chart. Oh, it's still telling me. Let's do that. So once I'm done charting it, it will close that window for me, and how I can view the information I just charted. There's several places. I can go into documentation and hit refresh. I will now see my adult renal assessment documentation here with all the fields I selected. Another way to view that information is go into form browser, and within form browser, I can also view the form, and it just brings me back to that form I just documented, and you can click through all the different sections and look at what I documented. So the other form that is used would be the renal quick assessment form. This is for all your follow-up clinics. So for all the patients that are coming for follow-ups, you no longer need to complete that form I just showed you that has a way more information. We will now be using the quick assessment form. It also has different sections built in, but much less than what we just saw. Again, the mandatory section is here with the asterisks. If we need to change anything, for example, we just document directly into it, complete the summary. There's also the renal symptom assessment management section that you would use depending on which clinic you're seeing this patient for. So if it's your regular kidney clinic, you can go and complete this section here and type in your notes. We have a section for GN clinic. We have a section for polycystic kidney disease. And what we're missing is the stone clinic section. So that is a gap that we've identified, and we will need to collect some requirements on what to build for the stone clinic section.
The nurses don't actually see patients in the kidney stone clinic. It's only the dietitians.
Only the dietitian? Oh, I see. Good to know. Can someone make a note of that? So in that case, if the nurses aren't the ones seeing the stone patients, then we don't need a section in here. Then that will probably be in a separate section for the dietitians. But otherwise, same idea. You would click in, click all your fields that you want, type in all your notes that you want, and then chart the form. Once you've charted the form, I will refresh it. And now you can see that I've completed a renal quick assessment power form. Again, you can just click into it to see what I charted. The bold sections will tell you there's charting in them. Or go into documentations, refresh, and see that the quick assessment power form is now a document type.
Hi, Flo.
Yeah.
It's Annie. So if we use this one, do we still need to chart in Promise?
No.
Okay, good. Don't want a
Yes.
double charting. Okay, good.
Yeah, totally. So now the use of this ad hoc form will take over your e-charting in Promise.
Okay, great.
Deborah, from Pause, you do still have to put the physical assessment into Promise, though, the BP, the weight, and the height. So you still have to do that.
So any of those core mandatory Promise fields, sorry, there's an ambulance. Yeah. So any of the core mandatory Promise fields that you enter in Promise, that still needs to be entered and updated in Promise. This information doesn't carry over. So even though we are charting most of our clinic notes in here, for all the things that are required for Promise funding, that still needs to be entered and updated.
So you mean like weight and blood pressure?
Yeah, weight, blood pressure, height, primary renal diagnosis, comorbidities, like things like that.
Okay.
The stuff on the core forms essentially. And like modality selection.
Oh, okay.
Those fields. Yeah. So those will still pertain in Promise, but charting wise and where you're doing all your notes will be in Cerner.
Okay.
Another area that ambulatory nurses will be documenting is, again, in your ambulatory workflow end page. If you scroll all the way down, you will see a nurse narrative note type. So if you click on that, it'll actually just bring you to a free text note. And this is where you can just type in your nurse's notes for that day of clinic. You can say, saw a patient today. Everything was good. See next visit, whatever, blah, blah, blah. And then from here, you can then sign your document. And then you might just want to say, KCC new as your note type, and then sign. Again, you also have the option to forward any of your notes to a particular provider if needed and just search for their name here. But otherwise, you can just write your note, sign it. And once you've signed it, again, you can refresh your screen. This refresh button is your best friend. I constantly refresh it. Anytime you update anything, you want to click refresh. So once you've refreshed it, you can go back into your document section and you should be able to see that note you just typed in.
Okay.
I mean, we don't use both in KPC. If we see a patient, we use the ad hoc. We don't also put a nursing narrative in. We don't put two notes for one clinic visit.
Oh, that's at St. Paul's. I guess, would there be cases when, say, you won't be seeing a patient, but you're calling them and talking to them over the phone and you want to document somewhere?
So sometimes if it's a virtual appointment and we'll do a pre-clinic assessment, then we'll use the nursing narrative then. Yeah. Or if we're following up some lab work, then we will use the nursing narrative.
Yeah. Yeah, so for the most part, if you are filling out the ad hoc forms, you don't also need to create a nursing narrative note. It's just there so that for any instance outside of an ad hoc form, you can use a nursing narrative note to document.
Okay, Flo. Some of our patients, we see them through the virtual visit, like a Teladoc. And inside the Teledot visit appointment, we do have a part like we can document the notes over there, and then the doctor were able to actually see the notes like live, because when we see the patient, we document it at the same time, and they were able to see our notes over there too, because they are also using Teledot.
So I guess your question is what happens with all the Teledot notes and how?
Exactly. I think this one I understand is mainly for the in-person visit, right?
No, so for virtual visits, you will also be using PowerChart.
So if it's a virtual visit, we're using this one, and at the same time we use a Teledot, and we still need to put the notes over there in order. So that means either one or the other.
I'm gonna have to turn to my team for this. I'm not really familiar with the Teledot application, but I feel like if you're using PowerChart to chart all of your documentation and notes, and if it's a virtual appointment, that means everyone is in front of a computer and will have access to PowerChart, then you don't really need to chart in Teledoc anymore, right?
That sounds about right. So Cerner would be your source of truth.
Okay.
Yeah.
Yeah, so it will replace your Teledoc and
Charting.
your chart. Yeah, you know that assessment sheet where you guys have the 4 different sections that will replace that.
Okay.
And everything will now be in PowerChart.
Okay.
Would you say like most of your appointments are virtual now?
I would say like maybe like 70%. The one who actually come in person is like when the kidney function is below 20, or they are kind of close to start dialysis, or some patient need the one-on-one education, and those person will be in visit. Most of them like either Teledot or is a phone appointment.
I see. Okay. Yeah, so in that case, I would say like, yeah, any of those phone encounters, virtual health encounters. So as the way Lori would be booking them and the other clerk would be booking them based on those encounter types. So we do have a phone encounter type. We do have a virtual health encounter type, as well as the outpatient in-person encounter type. So just based on which form of appointment type it is, that's how the appointments will be booked, but those are all linked back to PowerChart Cerner, where you will see all the same information, all the same documentation and history and things like that.
Okay, good.
Yeah, so it should be replacing your documentation in the other system. On that note, let me just go back to my, were there any other questions around documentation or how to view and the ad hoc forms? No? Okay. So on that note, I'm going to go back to my slides. I just want to make sure I captured all the things that I wanted to ask. Oh yeah, so if you guys do have, you know, any allergy documentation or immunizations, things like that, those can also be documented into Cerner. So we do have an allergies section. This is where all the allergies can be documented. You can add any allergies in here. And then for immunizations, if you know of any immunizations that the patient has received, this is where you can also document the history and add certain immunizations in here. We have a favorites folder for the most commonly used ones and also all vaccines in our catalog. So if you know of any, you can select the ones that the patient has, document it in PowerChart as well. So they're all in one place. And once those are documented, when you go back to your ambulatory workflow, you'll be able to see them in the allergy section as well as the, there should be a immunization section, or I might be wrong. Yeah, okay. So yeah, you can find allergies from the workflow review, and then immunizations will show all the history here. Medications. if you go into orders, this is where you'll see all the power plans and orders placed by provider. As a nurse, you can also place certain orders as well, either with co-signature or no co-signature required from provider. This is also where you can view the medication list if there are any documented. And similar to what I had described earlier in the provider section, if there are any medications entered here, you will see them in the different statuses. I would think for the kidney clinic, for the most part, all your medications would either be documented or prescribed. You won't have any active orders in this clinic. So if you keep a current medication list in here, this is just where at each visit, the provider or the pharmacist will have to complete a BPMH and review all the meds. That being said, we also want to ensure that the meds are still up to date and promise, because there is no interface between the two systems right now. So that may be the only place. That's one of the things that we'll still need to continue for the dual entry into two systems. For all the lab results, nurses can go into results review. And from results review, there is a, I would say most, sorry. Okay, sorry. I would assume most of your patients get their labs done in the community. Is that correct?
Yes, at the Life Lab. Yeah.
Yeah. Okay. So for those lab tests from external sites, there is a Lab Provincial tab that is built into Cerner now that pulls in all those labs from the community external sites. And so you would view all those patients' lab results through this Lab Provincial flow sheet. What else? Okay, so to Allied, I have questions for the pharmacist, dietitian, and social worker. And so for right now, how do you know which patients you need to see, and how do you currently get consulted? Let's start with the pharmacist.
So right now I'm screening all of the patients and seeing whether or not there's been any recent med changes based on PharmaNet, and then I'll decide whether or not I need to speak to them or whether I haven't talked to them in a long time, so I should check in with them. So I decide whether or not I'm going to be seeing or speaking to them.
Okay, and then in that case, so when you mean you screen all the patients, do you just have like a running list of patients that you go through, or whoever's booked for that week?
Yeah, I print out all the medications, all the patients who are booked for the following week, and I screen them the week before.
So you go week by week, whoever's booked, go through all of them, see if there's any changes that you can identify. And if you decide you do need to see them, then you notify the clerk?
Yeah, lately I've been focusing just on the phone appointments or the virtual ones. And going through those are most of the patients anyhow. Not many patients are coming in person.
Okay, so for the phone and virtual ones, do you still need to notify the clerks to book for you?
No.
Or you just schedule them yourself?
I just do it on my own time.
Okay, so if it was requiring a clerk to book, those would be the in-person?
Yeah.
And then for phone and virtual, I assume you use Zoom?
I use
or Teledoc. Yeah.
Yeah.
Okay. Virtual, then you book it yourself.
Yeah. I usually don't book my own Teledoc, so it'll just be phone.
Oh, I see. Okay. So phone. Okay, and so the clerk would book the in-person or the virtual then?
Yeah.
Okay, and what specific information do you need to review to provide care? So I heard you would review PharmaNet.
Yes.
Anything else you need access to see?
You mean just in general? Like I use Care Connect to just review recent admissions, and any labs that haven't been copied to Promise.
And where do you currently chart?
I chart in Promise.
And do you use any external documentation system other than Promise?
Not for myself, no.
Okay, and how do you communicate with the rest of the healthcare staff on your team if you need to? So like email, verbal?
Verbally or in person. Oh, sorry, verbally or email, yeah.
Okay. And so for the dietitian, Lynn, how do you know which patients you need to see and how do you get consulted if you need to see someone?
Yeah, so right now, it's a combination. So if we're booked to see patients, those are the patients we see. And I'm also screening similar to Hillary. So I would screen the patients coming, and if there's someone I haven't seen in a long time, I might call them. And then I also get referrals from either the pharmacist or the nurse. If there's things that I might need to follow up, or if I can see them in clinic, I might add them on.
So screening in a similar way as Hillary does, but also just whoever is booked to you.
Yeah, so we'll have patients already booked.
Yeah.
Yeah, so we know to see them or to call them.
Okay. And so I would assume you also do in-person, virtual, as well as phone?
Yeah.
Okay. And what type of information do you need to review? Labs?
Yeah, labs, the doctor's notes, and then just our previous notes.
Previous clinic notes. Okay. And where do you chart?
So we chart in Promise, and then for initial patients, we do the initial assessment paper form.
Okay. And do you use any external documentation systems?
No.
And how about how do you communicate with the rest of the staff?
Same, verbal or email.
Okay, and over to social work, same questions.
Yes, so very similar to the dietitian. There's patients that I'm seeing that are booked in my schedule. And I'm also screening, if similar to Hillary, the pharmacist, if I haven't seen a patient in a long time, I may request that they're booked in, either that visit or in a future visit, the next visit. So quite similar. And also a combination of in-person, phone, and virtual visits. Yeah. And then what type of patient-specific info? So I'm usually reviewing Paris, Care Connect, and previous clinic notes as well.
Okay. And so, like, in Paris, you said you had read-only, right?
Correct. Yeah. So I may look and see if a patient has a case manager, mental health clinic, or mental health team notes, for example, or home supports, things like that.
Okay. And where do you currently chart?
Same as the dietitian. So Promise for the most part, except for the initial assessment, it's a paper form in the chart that we fill out.
Okay, perfect. And Paris read-only.
Yeah.
Okay. And how do you communicate?
Same, verbal or email.
Okay. Good. I think I got the questions. Okay, so I'm just going to quickly demo. I'll just use social work as an example login. But for the allied, fairly the same. Again, if I can choose the right one. Where's my social work? Okay, here. So here's my social work login. I'm logged in as a social worker. What social workers and allied clinicians typically have is called a multi-patient task list. So it's essentially a list of patients that you get referrals or consulted to. This is one of the ways that the current live sites allied staff are using to keep track of the patients that they do need to see. However, it sounds like for you guys, it's really based on whoever is booked for the upcoming week, as well as just patients who are already booked to you. And because these patients are booked individually to appointments with each of you in the scheduling system. So if anyone was to send you an internal referral or a consult order, for example, if I was a provider, and I put in, say I'm a provider and I needed you to also see a patient, would that ever happen? Would a provider or a clinician notify you to ask you to see a patient specifically? Any of you guys?
Sometimes, yeah, sometimes. Oh, sorry.
Go ahead, Lynn, go ahead.
Yeah, so sometimes they might want us to either see them or to call them to follow up about, I don't know, supplements or something, some other issue. So usually be afterwards, unless we can squeeze them in.
Okay, perfect. So say if that was the case and a provider did want you specifically to meet with a patient, then what they could do is put in a consult order.
Hello, I think it's the it's social work consult. That's the order.
Oh, that's right. There you go.
The second one, yeah, there you go.
Okay, so say the provider wanted the social worker to see the patient, they would put in the social work consult order. And from there, they would just choose whatever reason that applies. Other, please specify. And in here, it would be, please see patient regarding MSP coverage or something. You guys cannot see my screen because it's on the other side. Okay, so for example, they would put in a consult order this way and it would say, please see patient regarding MSP. There are priority types that they can choose depending on how urgent they need this patient to be seen by you, and then they would sign. So once they've signed for the order, you as a social worker will then be able to see if there were any consults on your multi-patient task list. So first of all, I'm going to have to change my views so that I can see the location that I'm at. Oops. Did I click it correctly? It's not doing anything.
I think you might need to select the choose patient list on the left column and then highlight departmental view and then click save. And then I think.
Shouldn't there be a little check mark here?
Yeah,
there should.
Can you just maybe, can you maybe cancel out of this window? I wonder if you just have to right click on the assign task, like gray, like the dark gray toolbar. The assigned task on the kind of, yeah.
Mm-hmm.
And then right click.
Mm-hmm.
Oh,
yeah, it's the same. Sorry, some technical difficulties here. But what I was trying to do is select kidney clinic, which opens the building, which opens the ambulatory clinic location, and I should be able to select it so that it updates my list, and then I can click OK. I will go back and play around with it and make sure it works, but essentially what happens then is once I've selected my list location and I refresh my screen, it should now show me that consult order that the provider had just put in. And you should be able to see it on your multi-patient task list that says, oh, please see this patient regarding their MSP coverage. Or if it was for a pharmacist, please see patient regarding, Darby dose change or whatnot. And then if it was for dietitian, is please see patient regarding dietary supplements or something like that. So it should show up on your task list. And as these consults come in, you can just keep monitoring them from here. And as you see the patients and document on them, they'll fall off your list. So sorry, I couldn't show that. It usually lets me click on it, but for some reason, either I'm doing it wrong or it's not letting me click it. But again, this will be taught to you and reviewed during your workflow reviews and boot camps in more detail, so you can play around with it and practice doing it. But that's kind of the whole idea of how allied clinicians know that someone is either sending them an order, a referral or consult order outside of a clerk booking you in to see a patient as well. You can also create consult orders for yourself. And this is a good way for you. What the live site is doing too is to track your caseload. So as you know that you're screening through the patient's list for next week and you know you're going to see this patient, you can put a consult order for yourself as well so that it shows up on your task list and you can work off of that as your active caseload that you need to get through. And then down the road, if you ever needed to generate stats on how many patients you saw within a month, then you can run reports based on that order. Any questions there? Sorry, I couldn't show it to you guys in a better way. And then so documentation wise is the same. There are a bunch of ad hoc forms that are built specifically for allied health clinicians. Otherwise, you would also document a narrative note the same way as a nurse would by going into your documentation section and adding a note, and then you can choose it based on your position type and the type of note. And you can also document narrative notes this way, which will replace what you guys are currently doing in Promise e-charting. And once all your documentations are saved and done, it's pretty much the same functionality in the same way as the nurse's notes show up, and then you will be able to see them in your documentation section. If you filled out a power form, you'll be able to see them in your form browser, so on and so forth. There's also different workflow tabs specifically for allied clinicians. And so I'm just going to open up my test patient as a social worker. So say I'm opening up this test patient now, and my role to this patient is their social worker. I'm going to select that and say okay. And it's going to bring me to my allied health mental health summary page. And it's very similar to what the nurses have, what the doctors have, but you will have specific pages based on your position and your role. So social workers have a mental health one, dietitians have an allied health summary page that have also different options. And then within there, you can select the appropriate tabs. But the functionality again is the same. You would just go to your section and click through all the different components or different widgets to find the information you need. Okay, any questions? Sorry if I'm going too fast, but we will have some follow-up sessions as well as a very specific scheduling section to discuss any of the things that I may have missed. Just looking at time, I want to make sure we have enough time for answering some questions. But before we get there, I just had a few medication questions I wanted to clarify. So currently the kidney clinic does not stock any medications in the unit or in the clinic. Is that correct?
Yeah.
And we don't do any medication administration to patients unless they bring in their own medications for training purposes.
Yes, I think the nurses can speak to this, but it's just Hep B vaccines that we have in clinic that we will administer.
Oh, Hep B vaccines?
Mm-hmm.
That you guys would, the nurses would administer for the patients? Okay, should note that. So is this that a patient would get a Hep B vaccine ordered, they would bring it into the clinic, but the kidney clinic nurses are the ones injecting?
No, I get stock from the VGH pharmacy and I leave it in our fridge.
And who orders the Hep B vaccine?
I think everybody has a Hep B vaccine order in their chart.
So ordered by the nephrologist?
Yep.
You guys will use the VGH pharmacy for the Hep B's then?
Yep.
Okay. And you said that this was like a particular day, or when they're coming for a clinic and you know they also need Hep B?
I think there's some patients who will schedule in just for their Hep B vaccine. So they'll come in specifically for that. And then others, they're here for their clinic visit, and they'll give Hep B vaccines at the same time.
Okay. That's good to know. And so we do use the pharmacy for the vaccines. BPMH and MedReg is regularly performed by the pharmacists and nurses?
Yeah.
Okay. And then we went through clinical trials, which we'll talk to the coordinator about. Okay, so lastly, I wanted to talk about the follow-up and departure. So once a patient is seen in the clinic and they leave for the day, they could either be followed up every 1 to 3 months, 3 to 6 months, 6 to 12 months. Those were the days, the frequencies we got. And then it can depend on, from what I heard, is either a visit with a provider or a visit without a provider. And it could be with any of the other clinicians and allied health staff. When the patient leaves, Lori, do you currently give them any documents or appointments and things like that, appointment cards?
Before COVID, it was the patient came in, they had their appointment, they left with an appointment card.
Yeah.
Currently with COVID, depending on now the receptionists are working at home, like they're rotating.
Yeah.
So they would, we can either mail it out to them, or if the receptionist is in person, then we can get the date and time.
Okay, so if in person, give patient appointment card.
Try
if virtual, it can be mailed. Okay. All right.
Sorry, the phone virtual teledoc, those will all get, the PNG's receptionist will email us the follow-up appointment dates, and then we'll send out a letter. We'll add the rest of the providers, book it, and then send out a letter.
Oh, I see. Okay. Can be mailed. So appointment date from PNG MOAs, and then KCC clerk sends the letter. Is that right?
Yep, looks good.
Okay. Okay, so to my additional questions or comments, I guess. So for Promise, again, the current process of manual data entry in Promise will need to continue, unfortunately, as Cerner goes live, because there are impacts to program funding, the provincial reporting, data accuracy and completion. Some of the stuff will be replaced, but most of the essential data entry, like the core mandatory fields and all those essential data elements, those still need to be manually entered back into Promise. There's just no interface right now. The only interfaces we do have are the ADT, which is the registration data. But a good thing to note is that it's only partial data that's interfacing. So clerks still need to manually go back into Promise to complete the registration. And then there's some scheduling interfaces, which currently is only field for field interfacing for dialysis schedules. So everything else outside of dialysis schedule, it doesn't necessarily show in Promise, but we are sending data over to the Promise side. It's just the data is not front facing and you can't really see it. Otherwise, we do have labs interfacing from Cerner to Promise and some diagnostics, except for ECGs. Health information management. I know that there are some things that we do have to scan and put into the charts, which would be the patient photos. I'm not sure. Do you guys still do that? Do you guys still upload the patient photos?
Into Promise, yes.
Mm-hmm. Okay, so yeah, I think the only thing I had was patient photos may be printed and placed in a chart and uploaded to Promise. And you guys don't necessarily need to scan anything in color currently. Is that correct?
Yeah, no color.
Okay. And then I did mention that the clerks do need access to clinical information, and this is to help coordinate the day-to-day operations, data entry into Promise, and keep a patient chart up to date. And then you guys do send your chart to HIM for thinning. Is it still once a month, or what's the time frame for that? Or only when a patient is discharged?
Usually, I think some of the nurses do thin charts, but we don't really send them off anymore. So I believe just when the chart's discharged, they go to, yeah, health records.
I see. Okay. Okay, and then for reports, do you guys run any reports? I put yes. I would say mainly the Promise reports. Such as lab flow sheet, core data elements. Is there anything else? Are there any other reports you guys currently generate regularly?
The monthly GFR reports.
Oh, that's right.
Yeah.
It's a good one, Annie.
I always forget about this one.
Mhm.
Okay.
I also run MedList reports, but I don't know if that's under this.
Mhm.
Yeah, that still counts. Med list. And this is from Promise?
Yeah.
Also?
Mhm.
Okay, yeah. Anything else? Do you run any reports from PCIS? No?
Oh, from PCIS, you mean?
Mm.
Some of the reports like a patient's chest X-ray reports or ECG reports. Sometimes we do run printed through the PCIS.
I see. Oh, so like some of the results from tests.
Yeah, from the
and
results.
things.
Yes.
Okay, that stuff will be interfaced, so
Mhm.
not too worried. Okay, so these were the ones I was mostly concerned about.
Mhm.
And
And then for the
how
diet, oh, sorry.
often-
For the
Right.
dietitians, we just do the nutrition supplements, but we don't really run reports.
Okay.
Are you talking just through Promise reports or PCS reports?
I was just looking at the Promise reports for now because I wasn't sure if you guys ran reports from PCIS. Do you?
No.
Like financial stats, like things like that,
No, those
appointment
one, no.
reports. No? Okay.
Hello.
Yep.
With the transplant first thing, I think we'll be running the kidney transplant readiness reports weekly also. Starting soon, I
And
guess.
is that a Promise report as well?
Yes, it is.
What was it called? Sorry, Dan.
The kidney transplant readiness report in Promise.
Okay. All right. And I kind of just put in, you know, depending on which report, you could run it daily, weekly, monthly, annually, depending. Oh, this one. Are there any billing processes that we need completed within this clinic? Like how does the billing process currently happen? How does the PNGs, MOAs know when to bill for their physicians? Do you guys give them an appointment slate each time?
No. They already know because we give them our schedule for the week.
Okay.
like Wednesday for the following week, so they already kind of know which patients are KCCs.
Okay. Okay. Are there any particular forms that you guys use that are specific to VGH that you know of? Or we can ballpark this one and I can try and figure it out based on the forms we've collected. So for downtime, do you guys have any downtime procedures? If the systems were down, do you guys have a process of what to do or access to paper forms and things like that? If PCIS or Promise is down?
No, but that's,
No.
that's
Nope.
something that will be created.
Okay.
So you don't have a box with like flow sheets in them if you needed to do any charting while the systems were down?
Yeah, as far as I know, Wayne, we don't have that gray box as PHC was doing so.
Okay. So no, we'll need one. Yeah, because typically when we do implementation and go live, we do want to ensure that all the clinics do have an emergency black box or gray box, whatever you want to call it, that it has all the necessary forms that you'll need, anything required from professional practice, in the case of a downtime, so that you have everything at least accessible. There are also certain documentations and forms that will be accessible through Cerner when there is a downtime, and they're on these machines called the 724 computers. And so each clinic will have designated 724 computers. And with those computers, even if there's a downtime, you can still access those computers and access particular information within them. So we will be teaching and showing you all of that in your training and workflow reviews.
And just so you guys don't get too many expectations, it's only one computer per area as such. It's not like they're all 24/7. It's one computer that you all need to work off.
Yes, that is correct. And it's typically the one by the clerk's desk, I would say. Okay. So we don't really have a downtime thing, so that's something we'll have to look into and follow up on. And then others, are there any upcoming changes to this area that we should be aware of? So I did hear that there's that Kidney First initiative, kidney transplant first. Is there anything else?
No, just CST.
For us, we're the biggest change.
Flo, if you have time, you can use for the Allied Health multi-patient task list, you can try test.sw in build. It worked for me with the consult.
Yeah, I posted one in the chat too.
Oh,
so that worked for me as well.
You mean the login?
Yeah.
Okay, which chat? The Zoom chat?
Yeah.
Ah, okay. Let me try that.
I just wonder if it was your social worker login.
Yeah,
maybe.
Me too.
It just looked a little weird. So yeah.
Okay. That was the one I always use, but let me try the one you gave me. No. S.SW?
Yeah, yeah.
Ah, lovely. Okay. So this is what the multi-patient task list looks like. Thank you, Maritza and Puneet, that I was trying to describe. But essentially, if there were any consult orders placed for patients, you can log into your multi-patient task list and you'll be able to see what those tasks are and the patients that you'll need to see. And from here, you can pretty much access the patient's chart and go in and complete your assessments and documentation. All right.
Yeah, and then I think you touched upon this, but if there were patients that you wanted to follow, then you as the allied health would put in your associated following order. And then in the following tab, you would have a running list of patients that would be your caseload that you would continually see for whatever reason.
Yeah, so I can show you how to put in a following order. So say I am now seeing this patient and I know I need to follow up on this patient and I want to put a following order so I have it on my multi-patient task list. I can go into my orders. I can put in, what is it? It's a follow.
It's social work
consult.
Yeah, and then it's the fourth one down, following.
This one. Okay. And so this is where I can put more notes to myself as to why I need to follow up this patient. And then sign. And once I do that, if I go back to my multi-patient task list, where'd it go?
It's in the top under Care Connect.
Oh, there it is. Yeah.
Yeah.
I should be able to see following order, but do I have to choose?
Yeah, so you go to patient list. Yep.
Department
review.
Kidney care.
Kidney care, okay.
I think you might need to modify your date range because it's currently set from the 1st to the 20th of January.
Oh, let's do it till today.
Well, the patient would show up there.
Yeah.
The
order I just
placed.
Yeah, so the following order I just placed should show up here. But again, yeah, we will go into more details when you get your training for this section, but that's kind of the idea. If you had any consult orders or following orders, you will be able to see a list of them through these different tabs across the top. And that's all I had, you guys. Any questions? I know that was a lot. Oh my God, we made it just that time, sort of, a bit over.
Hey, Flo.
Yeah.
With the PCS reports, you're asking about the reports. There's a couple ones that are just auto-generated that Dr. Zalinardo has set up, and reports to the providers.
Oh, okay.
So they're just auto-generated. So.
Do you know what those are?
I can't remember the names of them. I think it's just, what I think that the providers can tell you which ones they receive each day. That's auto-generated. And then the one that Dr. Zalinardo has, it's generated on Fridays.
Okay.
I think it's for the doctors to see what kidney clinic patients are coming up the following week.
Yeah, I have a feeling. Okay. Yeah, I'll check with Dr. Zalinardo on that as well. It's more to see like patients that are booked for upcoming week.
Yeah, the one on Friday. And I think that the providers get a different one that comes every day. So I don't know what that one's called.
Okay.
It's just our schedules for the day.
Yeah, sounds like scheduling reports. Okay. Thank you. That is it. So if there are no other questions, thank you guys. We will have some follow-up sessions. We will have a scheduling session where we'll talk in more detail about all the scheduling processes with the kidney clinic. And then for our next steps, we'll have those booked. I think the scheduling session, I think, is booked on February 2nd. And then we have our first follow-up February 11th, and we'll possibly have a third follow-up or a second follow-up session, but that is to be determined. Okay. Thanks, everyone. Thank you.
Thank you, Flo. Thank you.
Bye.
Oh, it's nice seeing you again.
Yeah, you too.